All right, coming back to talking about the skull. So we finished the cranium in the last presentation. Now we're moving on from the cranium to the facial. Okay, so ethmoid, facial bones. Okay, facial bones. There's two unpaired bones in the front, the mandible and the vomer, and then a bunch of paired bones. So maxilla, upper jaw, zygomatic, which is known as cheekbones, your nasal bones, obviously your nose, lacrimals, the inside of your eyes, the palatine, and then a really cool bone called the inferior nasal conchae. Okay, so let's take a look at each one. Okay, the mandible is the lower jawbone and the largest and strongest facial bone. Okay, it's the only movable bone of the skull. So when our skull, for all the muscles and stuff it has, it only has one movable joint. That's this one right here. Okay, and that joint is called a temporal mandibular joint, or TMJ for short. And no, you cannot use that on the quiz. All right, or the exam. Okay. So let's take a look at all the major landmarks. It's composed of two parts. This bar right here, where all the teeth are plugged into, is called the body. And then you have two branches that stick up, and those are the rami. Okay, ramus for singular, rami for plural. Okay, so hold on. Okay, this is the body. This is the ramus right here. Okay. All right. All right. So here, okay, body, ramus. This thing right here is called the conjular process. Okay. The conjular process connects with the temporal bone, and this joint again is called the temporal mandibular joint. Okay. Okay, the maxillary bones. The maxillary is the upper jaw. Okay, the maxillary bone is known as the keystone bone of the face because it attaches to every other bone of the face except one. Okay, that one is the mandible. Your upper and lower jaw don't actually touch each other. Your teeth touch each other. The jaws don't. Okay, so there's a maxillary. Okay. The other bones of the face, the zygomatics, this is the zygomatics, okay? The nasal bone, okay? Let me show you front of the face. Okay. So zygomatic bone here in this weird little blue color. The nasal bone here in this deeper navy blue or whatever that blue is, okay? Okay. The lacrimals. Lacrimal comes from the Latin word lacrima, which is tear. Okay, so this is where your tear ducts actually run. Okay, and then your palatines is the upper roof of the mouth. So see if I can find that right there is your palatines. Okay. All right. All right. The vomer and inferior nasal conchae. These two are deeper, okay, and they're inside basically your nasal cavity. Okay, so let's take a look at what they look like. Okay, that right there, you can see the vomer right there. That's in light blue. Let me show you what the entire vomer looks like. That is the vomer. Okay, it formed basically part of the separation between your left and right nasal passages. Okay, so this is your nose right here, right? Obviously, and then you have the vomer, which separates the right and left. Okay. Okay. The last one is the inferior nasal conchae. That's the inferior nasal conchae. None of these drawings actually do a really great job of showing you what the inferior nasal conchae is. The best one is this. If you see it, that green thing that sticks into your nasal cavity and hooks around is the inferior nasal conchae. What it does is when you breathe air, and we'll cover this again in respiration, when we breathe air, those little hooks will actually cause the air to swirl, okay? So instead of the air going directly from your nose into your nasal cavity into your lungs, it will swirl around the nasal cavity, and the nasal cavity has all these mucous membranes, and that will trap all the bacteria, okay? In physics terms, it causes turbulence, okay? All right, special parts of the skull, the nasal cavity, the orbits. We'll skip the hair, nasal sinuses, the hyoid. Okay. So this is the orbit, okay? The orbit has a whole, this is the commonly known as eye socket, okay? There's a whole bunch of bones around it, okay? Your eye socket is not made from one bone, it's made from many, many bones, okay? Just like your nasal cavity, okay? So what I will ask you guys is to name some of the bones in your orbits and some of the bones in your nasal cavities. Like name 4 out of the 7 bones that make up the orbit. You should be able to name 4 of them, okay? Or 5 of them, okay? But I won't ask you for name all of them, okay? Okay, the hyoid bone, okay? The hyoid bone is here, okay? You can feel it, okay? When you talk and swallow, like you can put, if you put your finger here, you can feel this bone move up and down. That's the hyoid bone, okay? Um, the hyoid bone is the only bone in the body that is not actually physically connected to another bone. Okay, it's connected to your larynx and to also to your tongue, but it's not actually connected to another bone. So usually, a lot of skeletons, the hyoid bone is actually lost because it's not physically. But usually, bones are connected to the next bone. The hyoid bone is not connected to anything; it's just kind of roughly tied on. And usually that gets lost. Okay. The other interesting thing about a hyoid bone, if your hyoid bone is found broken, it usually means you've been strangled. Um, the force required to strangle will crack the bone. Okay. All right. Moving on, the vertebral column. Okay. Actually, before I do that, I will switch modes here and go back to the PAL, which is the AP software. And so you can hopefully see. Okay, so here is the mandible. Okay, so you can see the body. This is the ramus. This is the mandibular condyle. Okay. Uh, There's the side view. Okay. This curved surface is a condyle. So this is what you're doing to open your, rotating to open your jaw and moving to open your jaw. Okay. Posterior view, that's not really interesting. This is the maxilla. Okay. So you can see you have one jawbone, but you have two upper jaws. So this is your upper jaw. Okay. It formed part of the nasal cavity here. It forms a little, just a little bit of what we consider cheekbone here. Okay, that's the maxilla. The palatines, this is actually really hard to see. So this is the palatines. Okay, this is the horizontal plate. This is the, if you look up through the roof of your mouth, that's the plate that you come to. This is the rest of it. Okay, the palatine, the perpendicular plate is actually run inside your nose. Okay, and this is actually inside your nose as well. Okay, orbital process, so bottom of the orbit. Okay. Slide. Bicep skull. Okay. So here you can see the vomer. Okay. The ethmoid. Okay. This is not a great cut of the vomer. The vomer is usually slightly bigger, but it's just the way it's cut. Okay. Let's see if there's a better picture. Orbit, hyoid, anterior view of the skull. So here you can see the inferior nasal concha here. Okay. That is the other bone that I was trying to show you. Here are the lacrimals. Those are the little bones inside the eye, tear ducts. Okay. Okay. Next, the last one I want to show you, the hyoid. This is the hyoid. Okay. You don't have to know the parts of the hyoid. Okay, let's look at the vertebral column. Okay, the vertebral column is, as an adult, is formed from 26 bones. As a child, as an infant, you actually have more bones, but slowly over time they become fused. So in an adult, there's 26 bones. Okay, the vertebral column transmits the weight of the trunk to the lower limbs. It surrounds and protects the spinal cord. That's a more important thing. Okay. Okay. The vertebral column serves as attachment sites for muscles of the head and neck. Okay. It's held in place by ligaments, but you don't have to know the ligaments. Okay. So here, this slide you definitely have to know. Okay. So you have 5 sections, 1, 2, 3, 4, 5. Okay. So first part, cervical, right? Cervical vertebrae. Okay. So 7 vertebrae there. They're named C1 through C7. Okay. Literally C1, C2, etc., etc. Okay. The thoracic vertebrae, T1 through T12. Lumbar vertebrae, L1 through L5. Okay, you have, after that you have 1 sacrum. Sacrum is actually 5 fused vertebrae put together. Okay, and the coccyx is your tailbone. It's either 3 or 4 fused vertebrae fused together depending on who you are. Okay. Okay, so the vertebral column has 5 major regions, 7, 12, and 5. The easy way to remember this, the 7, 12, and 5. Breakfast at 7, lunch at 12, dinner at 5. Okay? Okay. One of my students made up cereal at 7, tacos at 12, and lasagna at 5. Whatever helps you remember. So sacrum is 5 fused vertebrae, and the coccyx is smaller than that. It's usually 3 or 4. Okay, but it's usually fused together. So if you write 1, that's fine. Okay. The curvatures of the spine. Okay. The cervical and lumbar curvatures are concave posterior, so they go that way. Okay. The thoracic and sacral curvatures are like the C. Okay. C-shaped. Okay. Your spine when you were born is C-shaped. Okay. If you look at like cat spines or dog spines, they're C-shaped. Okay. Ours is different. Okay, because we stand up. Okay, so to stand up, we have to develop new curvatures. Okay, and these are, so the primary curvatures are naturally present. The secondary curvatures, the cervical and lumbar curvatures develop, okay, over time. Okay, the first cervical curvature, or the first curvature to develop is the cervical curvature. Okay, that curvature allows you to hold your head up, and if you ever had babies, babies all approximately are able to hold their head up at about 6 months of age. That's when the cervical curvature develops. Okay, that repositions their head to right over their spine, so they actually hold their head up. The lumbar curvature develops at about 12 months of age. Okay, this is why babies learn to walk at about 12 months of age. Okay. All right, we'll skip the ligaments. Okay. The intervertebral discs. Okay. Oops. I did something there. Hold on. Really? I crashed my entire PowerPoint? Okay. Sorry. I apologize. We had a technical issue. All right. Slideshow. Slide. Okay. The intervertebral discs. We talked a little bit about them as a social fiber cartilage. Okay. So the intervertebral discs are cushion-like paths between the 2 vertebrae, and they consist of 2 parts. Okay. The nucleus pulposus, okay, which absorbs the compressive stress. Okay, it's the inner sphere, and then the annulus fibrosus, which is the where the fibrocartilage actually is. Okay, and here you can see the 2. Okay, the nucleus pulposus is inside, annulus fibrosus is on the outside, and if you pay attention to sports or old people want to slip discs, is literally slipping the nucleus pulposus out past the annulus fibrosus. Okay. 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 So let me see. There you can see it there. I think this animation is really cool to show you just exactly where the spinal cord actually is. And the spinal cord is actually very narrow. Okay. 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 So first, this is a very common vertebrae. Okay, this is a typical vertebrae. So let's go over the parts of a typical vertebrae because you definitely have to know these. Okay. Okay. So every vertebrae except one has a body. So there's a body. Okay. All the vertebrae have 2 foramen. Okay. One is right here. Okay. Called the vertebral foramen. the vertebral foramen runs through every vertebrae, and it is where the spinal cord runs through. Okay, the other foramen is right. Oops, let's split a second longer. Okay, it is that hole right there. Okay, it is in between two vertebrae. Okay, and it's called the intervertebral foramen. The spinal nerve runs out of the intervertebral foramen. Okay, the spinal cord runs in the vertebral foramen. The spinal nerve runs out of the intervertebral foramen. Okay. 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 The superior articular process. Okay. The inferior articular process are right underneath, on the other side of the bone. Okay. The superior of one touches the inferior of the one above it. Okay. So the superior articular process are here. The inferior articular process of the vertebrae above it are there. And this is how your vertebrae stack on top of each other. Okay. The transverse processes are here. Okay. And then this sharp thing that comes out the back is the spinous process. Okay. Okay, that's fun. Okay. Okay, so we went over the body, we went over the vertebral foramen, the spinous process, the transverse process, the superior inferior articular process, and the intervertebral foramen. Okay, foramen or foramina, it means the same thing. Okay. Okay. I don't know why my thing keeps screwing up. Okay, so let's look at the cervical vertebrae. Okay, the cervical vertebrae, there's 7 of them. They're called C1 through C7. Okay, C3 through C7 are typically cervical vertebrae. Okay, their body is wider than normal. They have a short spinous process, and the end of the spinous process splits a little bit, and so it's called bifid. It splits into 2 little processes. Okay, except C7. C7 is unique. Okay, so watch. If you put your hand on the back of your neck, okay, you put your hand on the back of your neck, you'll feel a bump. And when you move your head, that neck back and forth, like if you shake your head yes or no, that bump will not move. That bump that you're feeling is the spinous process of C7. Okay. Okay. One of the things that we'll ask you to do is tell vertebrae apart from one another. Tell cervical vertebrae apart from thoracic vertebrae and from lumbar vertebrae. Okay. Cervical vertebrae are easy. See these 2 holes? Okay. Those are cervical vertebrae. Okay. Those are transverse foramen. Transverse foramen are only in cervical vertebrae. There's something called vertebral arteries that run up your neck. Okay, they have to run through those holes. Okay, and you also have nerves that run up through those holes as well. But the major part of it is the artery running up. Okay, and so they're only in the neck. Okay, so if you see those little holes, then you know that you're looking at cervical vertebrae. Okay, so here it is. That big bump I told you to feel is that sharp point there. Okay, you should be able, if you press in deep, you should be able to feel this bump as well, but it's not quite as pleasant to feel, and that will move with you when you move your head. Okay. Okay. C1 is special. C1 is called the atlas. Okay, in case you were wondering why it's called the atlas, it's named after the Greek titan Atlas, who held up the world. Your head is the world. The atlas bone holds up the world. Okay, C1 lacks the body and the spinous process. Okay, you'll see what happened evolutionary to the body in a little bit. Okay, so this is C1. So notice there's no body here. Okay, there's just a big hole where the body is. Okay, but there's still the transverse foramen. Okay, there's also no spinous process. Okay, there's a backwards and upside down version of it. Okay, now let's look at C2. C2 is called the axis. Okay, because it allows you to rotate on your axis. Okay, it has a body and a spinous process, but it also has a dens. Okay, so that sharp point there is the dens. I'll show you a better picture of the dens. It looks like a little tooth sticking up. Okay, what the dens actually is, okay, it used to be the body of the atlas, but instead became fused to the axis. So this is going to be like dens, okay? It's going to be a little tooth sticking out. This is by C1 now. Remember, my C1 has no body. So now I can rotate this around that very easily. That allows me to do this. Okay. Okay. So that is a very important thing on the dens. Okay. Okay. Thoracic vertebrae. Okay. The thoracic vertebrae. Hold on 1 second. All right. Okay. So thoracic vertebrae. The thoracic vertebrae, the reason why they're thoracic vertebrae is they attach to ribs. They attach to your thorax, where your ribs are. So all thoracic vertebrae attach to ribs. Okay. Okay. So they have heart-shaped bodies from the superior view. So this is the superior view. They have heart-shaped bodies. Okay. Their spinous processes are long and point. Inferiorly. Okay. So all of this is true. What I want to show you guys is how you distinguish thoracic vertebrae from lumbar vertebrae, etc. Okay? Okay. So here, okay, see this? Okay. When you look at this, I hope most of you guys will get it right away. But you see the giraffe? Face of the giraffe, ears of the giraffe, horns of the giraffe, nose. Okay? It looks like a giraffe. The reason why it looks like a giraffe is that the spinous process is long and pointed down. Okay? All right. The lumbar process, okay, for lumbar vertebrae, it is thicker and pointed straight out. Okay? And if you look at the lumbar vertebrae, I hope you guys see this. You guys see the moose, face, antlers, like facial things, whatever that hang off the moose. Okay, but moose-like. Okay. The other way to think about this, the way that my anatomy teacher taught me, the spinous process of the lumbar vertebrae looks like an axe. Okay. For the spinous process, it looks sharp and pointed downward. Okay. All right. So Hopefully we'll go over that in the review session. Okay. The sacrum. The sacrum is this thing that attaches to your hip bones. Okay. It forms the posterior wall of the pelvis. Okay. Basically, the only thing on there that I want you guys to recognize is that sharp point right there, and that is the sacral promontory. Promontory literally means lookout point, like where you look out onto the ocean, like standing on the beach and stuff. That sacral promontory, the reason why that's important is because that's a good landmark for your whole body center of balance. Okay. Okay. So the center of gravity is about 1 centimeter posterior to the sacral promontory. Okay, so what a little bit just beyond it. Okay. Okay, coccyx is the tailbone. It's either 3 to 4 is the usual designation, but 3 to 5 is fine. Fused vertebrae. Okay. Okay. The thoracic cage. Okay. Forms the bony framework of the chest. Okay. The thoracic vertebrae posteriorly, the ribs on the lateral side. Okay, so let's talk about the thoracic cage. Okay. So here's the cage. Actually, I want to go through this picture. Okay, this is the actual cage. So you can see what it protects. It protects the heart, right? You have this thing right here. Oops. You have this thing right here called the sternum, the heart, and the vertebrae. And what you're actually trying to do, okay, is when you do CPR, okay, some of you are CPR certified. What you're doing when you do CPR is you're trying to push this bone into that bone, and the heart is in the way. That's what CPR actually is. Okay. All right, so let's talk sternum. Your sternum is made from 3 pieces of bone put together. Okay. And the sternum looks like a sword. Okay. In particular, it looks like a Roman sword called a gladius. Okay. So here is a sword. So you see the sharp sword here. Okay. This part is the sword handle or the manubrium. Okay. Literally, manubrium sword handle. Here is the body. And here is a sharp pointy thing called the xiphoid process. Okay, xiphoid literally is another sharp stabby thing. It's a little dagger. Okay, the xiphos, so xiphoid or xiphoid process. Okay, xiphoid. Okay, either pronunciation is right. Okay. All right. The jugular notch. You can pop out that by yourself. So right at the base of your throat, there's an indentation right there. Okay, that's the jugular notch. Okay. The sternal angle is where the manubrium joins the body. Okay, so you can see the sternal angle right there. You can like if you have you can palpate on yourself where the sternal angle is. Okay. All right, the ribs. Okay, the true ribs attached to the vertebral column posteriorly. Okay, all ribs attached to the vertebral column. You have true ribs and you have false ribs, and then out of the false ribs, there are 2 ribs called floating ribs. Okay, so let's go through this picture. Okay, rib number 1, 2, 3, 4, 5, 6, 7. Those are your true ribs. The reason why they're called the true ribs is they attach directly to the sternum. Okay, ribs 8, 9, and 10 are called false ribs because they do not attach directly to the sternum. Okay, this is rib 10. Rib 10 attaches to the cartilage of rib 9. Rib 9 attaches to the cartilage of rib 8. Rib 8 attaches to the cartilage of rib 7, which then attaches to the sternum. Okay, so false ribs. The other two are not only called false ribs, they're also called floating ribs. Okay, so floating ribs is a subset of false ribs. Okay, the floating ribs are the most easily broken ribs. They only attach to the vertebrae in the back. They don't attach to anything in the front. Okay. Okay. So let's go through the disorders of the exoskeleton. And I have a couple of these. Okay. The cleft palate is a common congenital disorder, and you can see, I think some of the, I'm sure you can find a picture of someone with a cleft palate. Okay, easily fixable surgery. Stenosis of the lumbar spine. As we get older, the vertebral canal narrows a little bit, and that can lead to compression of the spinal nerves, and that can lead to something called sciatica. Okay. Okay. The abnormal spinal curvatures. Scoliosis is a abnormal lateral curvature. So this is your spine. If it goes to the side a little bit, it's sclerosis. Kyphosis is a exaggerated thoracic curvature, like you see on like old ladies and stuff. Lordosis is an accentuated lumbar curvature. So the lumbar vertebrae, instead of it sticks out a lot more, okay, than usual. I'm not sure if it's in this version of the textbook, but in the older version of the textbook, there is a skinny African American lady who looks pregnant in that picture, but she's not. Okay, it's actually her vertebrae sticking out. Okay, fontanelles. Okay. The hardest thing, I'm a guy, so I've never had to experience this one, but the hardest thing about childbirth is pushing the head through. Okay, and the head, okay, at that point is the skull is not completely ossified, and that's a good thing because it allows the skull to move a little bit as the head comes out, which allows for, you know, it to be a little easier. Okay. Okay, so these are the fontanelles. The term fontanelle actually means little fountain. Okay, and the reason why they're called little fountains is because they actually move. Okay, it actually pulsates. Okay, this is why they tell you, hey, you know, during the first 6 months, don't push on the baby's head, like right there, because you can. There's no bone there, so there's only membrane that and you can push directly into brain. Okay, brain is very soft and squishy and easily damaged. Okay. Okay, so my funny personal story about fontanelles. Okay, so you know I've taught anatomy for many years. Okay, and so after my wife had her first child, you know she breastfed in the middle of nights and stuff like that. And one night I woke up and I looked at her and I was like, why the hell is Sammy's head like pulsating? And like I freaked out. I was like, why the hell is her head pulsating? And my wife looked at me like, oh, the stupidest person on the planet. And she was like, that's her fontanelle. They're supposed to pulsate when they suck. I'm like, oh, right, shit, okay. And then I went back to sleep. Granted, this was like 4 a.m. in the morning. So, you know, me being fully conscious, not really there. But, you know, even though I teach this stuff, I can occasionally screw it up as well. Okay? All right. So there's the fontanelle. Okay. So, okay. Okay. The aging of the exoskeleton. The water content of the intervertebral discs lessens, so it becomes stiffer, okay, and less squishy, and it also causes compression. So you lose about 1 inch in height. The thorax becomes more rigid, okay. The the bones lose mass. Okay, and that compression can also lead to compression of the spinal nerve, because remember, the spinal nerves come out through the hole, and the hole is smaller than it can compress. Okay, all right. We'll stop this presentation over there. This one's not over. I still want to go through the PAL presentation. So, okay. Oh, move this out of the way. Exoskeleton, vertebral column. Okay, so there's an entire vertebral column here. Okay, you can see the little black holes there. Okay, are the intervertebral foramina. Okay, cervical vertebrae, thoracic vertebrae, lumbar vertebrae, sacrum, and I didn't even show the coccyx here. Okay. So let's go through one of these vertebrae. We'll leave that. Okay. So this is the atlas. Remember, there's no body, okay, and there's no spine. Okay. So transverse foramen. Okay. That's nothing. That's just a weird little thing that I got attached. Okay. Next slide. Atlas. Okay. Superior view. What side view? Inferior view. They don't have a side view of the dens. Okay, so I'll show you that during the presentation. I'll bring in the slide here. That's the dens. Okay, you can't see very clearly in the picture, but it sticks straight up. Okay, it's in one of the lab review photos. Okay, so this typical cervical vertebrae, you can see the transverse foramen here. Okay. Cervical vertebrae. That's not interesting. That's not interesting. Thoracic vertebrae. This is. Okay. So this is a thoracic vertebrae, and thoracic vertebrae attached to ribs. And because they attach to ribs, there's little indentations where the ribs actually attach. Okay. And so here are the costal facets. Okay, costal rib. So there's an indentation on the body where the ribs enter. There's also another indentation on the transverse process, and then label on here. But there's actually a little indentation there, and you can see it when it's not colored in. There's a little spot right there where the rib will plug in. Okay, this is the superior articular facets. See how it sticks up. Okay, the inferior, we'll show you in a little bit. Okay, the inferior right here. Okay, there's one right there, there's another one right there. Okay, here you can see, let me try to rotate the view a little bit. Okay, see the giraffe? Ears, nose, or snout, or whatever, nose, okay. Okay, spinous process. All right. Ooh, this is lumbar. Let me find a better view. Okay, lumbar, the body is bigger. Okay, instead of looking heart shaped, the body looks like kidney shaped. Okay, here you can see the spinous process is much bigger, much straighter. It doesn't point down at all. It just comes out and looks like an axe. Okay, and let me rotate the view and we'll try to show you moose. Okay, moose. Okay, so ears, antlers, big long face, big long huge face. So cervical vertebrae. Okay, there we go. You can see the dens right here. See how there's a sharp pointy thing in the back right here. And so that's actually the dens. That allows you to rotate your head. Nope, not in the picture. Not in the picture. Sacrum. Full. All right. So next thing I want to show you guys, the thoracic cage. Last thing. Okay. So ribs. The only thing you have to know about the ribs is which one are true ribs, which ones are false ribs. Okay. So here you can see. I'll show you a better picture of the sternum. Okay. Sternum. Okay. That little indentation is a jugular notch. That's the sternum. That's the sternal angle. That's the body, and that's the xiphoid. Okay. That's the rib, and that's the rib. Okay. All right. Stop sharing. All right. So that ends this presentation. We'll go over this again in class, and I'm trying to figure out when we can sit down and have little groups instead of just big groups. All right. I will see you guys soon. Okay. All right.